Hi, I'm Jay. I work for the Tasmanian Aboriginal Centre here in Launceston, also statewide. I work for the Quit Smoking program, but in our Aboriginal language of Palawakani, we call it the Makarat Patapa program, the Stop Smoking program. Well, being an Aboriginal community-controlled health service and providing continuity of care, one of the main things is trying to identify who does smoke, who doesn't smoke. This is done through cold calling and contacting members of our community, having conversations around the program that we operate, what we can provide, educating and informing. I think building those relationships with people that are smokers, also non-smokers, because they have family members that are, and them understanding that there is a person that they can call or contact, or at least get some advice off. That's part and parcel of this whole journey and growing the program. The common thing with everyone that's quit, in one way, shape or form, people have relationships with cigarettes. And it's a negative relationship, positive relationship. Some people don't want to quit because they're happy with it. And by purely understanding that as workers that are working in this space, that it's a relationship, it's a coping strategy, it's a coping mechanism, that there's an inbuilt emotional attachment to it, a societal attachment to it, an environmental attachment to it, all those things, you can understand why then, yes, it's going to take multiple times to quit. The client, the person, the community member needs much information and resources and understanding of all of that to be successful in the long term. And that's a long-term process. It's not just, we're going to get you quitting, you're going to quit. No, it's not like that. So we need to just be able to build relationships over a period of time where people are actually comfortable coming to us and saying, look, I'm ready right now. Now, how does that look? It looks like, could be a conversation, having a coffee. It could be a phone call. It could be when I operate a promotional day. It could be when they're in here to see the doctor, or it could be when they're in here for the diabetes clinic, and they might just wander over and speak to you. There's multiple ways to address this, but we sort of need to work on people's ambivalence over time. I think breaking down those barriers, people don't really want to be contacted sometimes, but when they understand that I'm not trying to force anything onto them, and they understand that I'm just trying to give them some information, they're pretty open to hearing what I've got to say. And months later, some people call you back and contact you and are ready to hear what you've got to say in a more meaningful way, and they want to make change. So they ask for more education around the products, etc. Yeah. There is no failure in this area. If you're willing to try for yourself, you're already winning. Yeah. Probably the financial barrier of the cost of the products, I'd say. The replacement products, nicotine replacement products aren't cheap, but I tell you what, you'll eventually get off those nicotine replacement products. The cigarettes, they'll eventually kill you. Get people in this sort of organisations who want to do this work that are non-judgemental and probably have lived experience or understand, because nearly all of us have been touched by people that have passed away or experienced nicotine-related illness. Be open-minded to, I'm not just trying to push all this information, our products and everything onto you. Understand there is grey areas, understand that the end goal is to quit, but it's not the main goal. The main goal is to give people education in this space, getting them ready to quit.